Welcome back from the break. You're still watching This Morning here on Metro TV. I'm Desmond Tokreku, as you can call me Desifading this time. I mentioned earlier before the break that we have a discussion coming up on childhood respiratory diseases or respiratory diseases in children. My guest is Dr. Kwabena Osman. He's a senior lecturer and consultant pediatrician at the University of Ghana Medical School. As we get to talk about this, we are live on Facebook and Metro TV Ghana. Good morning, sir. You're welcome. Good to have you. Now, childhood respiratory illnesses or diseases. The first place, when we talk about respiratory diseases, I wasn't too good as a student. So just take us back and let us understand what respiratory diseases are.
Good. So respiratory diseases are diseases or illnesses that affect the respiratory tract, which is the place we breathe through. So right from our nostrils down into what we call the lungs, the two organs that are in the chest that help us to breathe. So any illness that affects that tract is called respiratory illness. Okay. And the airway itself is divided into two. So we have the upper airway and the lower airway. And that division is important because the organisms, the germs that affect the upper airway are a little different from those that affect the lower airway. Okay. And the symptoms you also have with your upper airway infections are a little different from the symptoms you have with your lower airway. Okay. Yes.
Great. So just give us a few of the illnesses, generally respiratory illnesses that you can mention to us.
Well, the most common one is common cold, what people call catarrh.
Oh,
yes.
Okay.
So it's also a respiratory illness. Yeah. So that is the most common one. You can have throat infection, which we call pharyngitis. You can have now topical is COVID. COVID is also a respiratory illness. You can have a common one that is in children. We call it bronchiolitis. And another common one that I know a lot of people have heard of is pneumonia. Okay, so they are all respiratory illnesses. There are a whole list of them, but at least these are the common ones that you can think of.
Okay,
yeah.
So let's narrow it down to children.
Sure.
Now you mentioned bronchiolitis. The other ones also in children, as we're talking about children now.
Sure. Yeah. So maybe I should talk a little bit about common cold before I talk about bronchiolitis. So common cold, we get it all year round. We know that it's more common in certain times, maybe the rainy season, in temperate areas where they have winter and summer. They see common cold more during the winter time. And we also see it more during the rainy season when the weather is a little cooler. So children will get it, especially children in daycare. They will get common cold so many times during the year, and it's because when you get what causes the common cold, they don't build permanent protection for you. Okay. So when you get one virus, usually it's caused by virus. It's one virus lets you get a cold symptoms, and you get over it. You get another one, and because you don't have protection from the previous one, you will get the same symptoms again. So some studies actually show that some children in daycare can get as much as 11 to 12 times of this common cold in a year. Okay. Yeah, and that is a lot bothersome to parents, of course, seeing their children having these symptoms. So for the upper respiratory illness, the common cold is what I can talk about. When you come lower down the lungs, is the bronchiolitis that I'm talking about. That's because it affects the lungs, tissues, and all that goes on. It usually will result in some of the children having difficulty breathing and other symptoms, which normally will lead them to go to the hospital and probably get admitted to the hospital. Okay. Yeah.
Is there any disease, the respiratory disease that can be passed on from a parent onto a child?
Oh, you mean hereditary?
Yeah.
No. These are all caused by infections. Okay. These respiratory illnesses are caused by infections, so they are not hereditary. They are usually contagious. So like I have cold and I sneeze around and I spread it out and a little child gets it and they get the cold symptoms. So it's not hereditary, it's more like spread by infection, like
Isn't
contagious.
asthma part of respiratory disease?
Yeah, so asthma is a respiratory disorder, but it's not caused by infection.
Okay.
That one is more due to the makeup of your lungs and other environmental things that come together to give you the asthma symptoms, but it's not caused by infection. Yes.
Okay. Now let's move on and talk about the symptoms that comes with childhood respiratory illnesses.
Yes. So usually when you have childhood respiratory illnesses, something like common cold, these children will have runny nose. Some of them will have copious runny nose, like a lot of discharge from the nose. Some of them will have their nostrils blocked, what we call catarrh, so they will have difficulty breathing from that. Some of them will cough. Cough is a very common symptoms of common cold and other respiratory illnesses. Some of them will have fever, okay, and the fever can be a low grade one or it can be very high fevers, all depends. And some will have the most worrisome one is having difficulty to breathe. So they will have difficulty breathing. So, and that is what usually will lead a lot of people to come to the hospital to be seen, and based on evaluation, they will have to be admitted or not. Some will also, when you come to the hospital, sometimes we can check what we call your saturation. So due to the respiratory illness, they can have low saturations. The oxygen saturations will go down to the extent that they have to give them oxygen for them to keep their saturations up. So the symptoms are varied. These are just few of them that I have mentioned, the very common ones that children with respiratory illnesses can present. Those are the ones that I have mentioned.
Okay, so what about, should they be treated with antibiotics?
No, it's not every respiratory illness that needs to be treated with antibiotics.
Okay.
Some of them may need antibiotics. You know, antibiotics are for bacterial infection. If you have a viral infection and you treat with antibiotics, it's not going to help. Actually, you create problems for us in the medical field. So it's not every respiratory illness that you have to treat with antibiotics. That's why it's important that the child needs to be evaluated by a healthcare professional and decide whether the child needs antibiotics. Because when we use antibiotics indiscriminately for viral illnesses, we create problems by causing what we call resistance to these antibiotics.
Okay.
So it's not every respiratory illness that needs treatment with antibiotics. It depends on what we think could be the cause.
Okay.
Yeah.
Yeah, and also, you know, parents, when some of these things happen, they want to treat, you know, it's in the house and
Yes.
go see. How dangerous is that?
Yeah. So we always recommend that if the child is having respiratory symptoms, and the best thing actually to do is to, in terms of infants, is to clear their nostrils, suction their nose. In older children, they can blow their nose. If they have fever, they can be given paracetamol to reduce the fever.
Okay.
So long as they are breathing normally and they are not having difficulty breathing, they are not having high fevers, okay, they are drinking well, you can manage them, you can watch them,
Okay.
and not do anything, just treat the fever, suction their nose, and that. But if they are having high fevers, difficulty breathing, that tells you that they need to see a doctor. And after the doctor sees them, they will decide if they need antibiotics or they can still be just monitored.
Okay.
Yes.
If you just tuned in, you're watching this morning, our discussion this morning is about childhood respiratory illnesses, and Dr. Kwabena Osman is my guest this morning, and he's a resource person with St. Luke's Clinic, and we'll get to talk about the anniversary also. But you mentioned that there are times and seasons where these things happen. So how do we prevent that? Is there any way we can prevent that?
Yes, so prevention is very important. One key prevention measure is hygiene.
Okay.
We need to keep ourselves clean. Okay. Most of these infections, respiratory infections, are spread through by coughing and sneezing. So we have to learn the right coughing and sneezing etiquettes. Cough in a handkerchief or in your elbow, sneeze in your elbow, cough in a sneeze in a handkerchief. Those are the things that will prevent spreading. And washing of hands, okay, because the viruses, if you wash your hands thoroughly, properly, you clear them from your hands and you don't spread them from one person to the other. Okay. So prevention mainly is through keeping ourselves hygienic by observing the respiratory etiquettes like I've mentioned here.
Okay. Now let's talk about the anniversary. I understand something great is happening. Tell us more.
Yes, so St. Luke's is 42 years.
Okay.
They've been in existence
42?
for 42 years. They've been there for that long.
I'm going to try and do the calculation. 19,
yes.
19, oh, it will come 1980. 1980.
Exactly. So they want to give back to the society by organizing some health outreach. So that is happening on the 9th and Friday 9th September and Saturday 10th September. And they are doing this to give back to the society. Dr. Kwabena, who started the clinic of blessed memory, had a lot of love for children. He was a member of the Pediatric Society of Ghana. And he did a lot for children, taking care of children. And in his memory, they are organizing this healthcare to give back to the society. So these 2 days have been set aside from 8 a.m. to 4 p.m. To have this health screening. It's going to be for all, even though St. Luke's originally was mainly a children's clinic. Now they they see adults as well. And this screening is for both children and adults. They have a varied things they are going to screen, check the eye, check your blood pressure, your sugars. And
it's free?
Yeah, it's all free.
Okay.
They are partnering with other people. So anybody who wants to partner with them can get in touch and can help make this screening very successful.
Where is St. Luke's Clinic located?
So it's located in Airport Residential Area, right?
Airport Residential?
Yeah, Airport Residential Area.
Okay. And the date again?
It's on the 9th and on the 10th.
The 9th and 10th of September.
Yes.
Okay. Thank you very much, Dr. Kwabena Osman, for joining us this morning. And he's a resource person from St. Luke's Hospital, as we talked about childhood respiratory illnesses or diseases.